Welcome nurse Averil Walters. Hi, Miss Walters.
Me.
Good morning. So why did the Ministry of Health in Nevis decide to give free pap smears? And what exactly is a pap smear?
Actually, it wasn't the Ministry of Health. It was decided by Nurse Ermin Jeffers, who was our then coordinator of community services, that the numbers were looking very low. And so what can we do to increase our numbers for pap smear uptake? And so she said, since January, cervical cancer month, maybe we can use that month and use a Saturday so we can attract more persons, because persons were complaining that the time and the day was not appropriate for them. And so hence, that's where it all started. She did the initiative.
Okay. And can you tell us exactly what a pap smear is?
A pap smear or pap test, that is usually called, is so simple. This is in my words though, just looking at the cervix and taking some cells from it to detect if there are any abnormalities or any changes in the cells, which can later lead to cervical cancer.
In terms of the numbers, I mean, being a female myself, I know once you get to a certain age, everyone should be having pap smears. So is that the case? Was that you're not seeing all women getting pap smears in Nevis?
No, we're not seeing all persons. The thing with the pap smear is that according to the American Cancer Society, they're saying they have a schedule and saying that the
pap smear and cervical cancer.
They're saying that you can have a pap smear. Under 21, you don't need to have one. That's what they are saying. And they're saying that between ages 21 to 65, you can have it once every 3 years. However, we look at person's history, and we are saying if you are sexually active before age 21, 3 years after that, you should have your first pap smear. And we are also saying between age 21 to 65, you have if you have 3 normal pap smears, then we tell you once every 3 years. So we go according to the person's history. Take the history into consideration and tell them when we think they should have the pap smear. Because if we had a lady coming at age 70 for a pap smear, we can't tell her 65 has passed and she can't have it, because she may not have had a pap smear since she was 50. So what happened between there? So hence we have to kind of vary it accordingly.
Understood. So do you have an idea of what may be discouraging women from going and get pap smears?
Well, a lot of women, when we ask, they call the speculum a duck beef. And so they said they don't like the duck beef because it's very uncomfortable. I mean, not uncomfortable. Well, some say it's uncomfortable, some say it's painful. However, being a woman myself, I have had to take pap smears. So I know it is very uncomfortable. But for as far as the pain, I don't think it is that painful, but persons are different. And so if they feel pain, but we try as much as possible to make it comfortable for the client, and we explain to them and we make sure that we allay their fears the best way that we can.
Right. I mean, as a woman myself, it is uncomfortable, but it is, from my experience, it's not painful. And I think I would prefer a few seconds of discomfort as opposed to, having cervical cancer and not being aware of it. So can you tell us what happens when you test and there are abnormalities? What happens then?
Okay, when the results are back and there's an abnormality, the pathologist will usually say to us, this is the recommendation that he's recommending. We repeat it in 3 months or 6 months. Sometimes when we call the client for their results, what we do, we give them the information from the pathologist, and we say to them that you can go to your doctor, repeat the test, and let you and your doctor decide how you're going to do. What are you going to do about the results? Sometimes the result is false positive. The person may have had sex previously before, and even though we advise them to, sometimes things happen. They might have used a tampon, their period might have just finished, even though we advise them. If sometimes things just do happen, and anything that touches the cervix will cause a change in the cells. So sometimes you get a false positive. So we kind of explain to them that it's not always that when there's an abnormality is that you have cervical cancer, because there are other tests we have to do to make sure that that is the case.
Okay, so can you tell us what are any of the symptoms of cervical cancer?
Some of the symptoms the person can experience will be abnormal bleeding. Abnormal is that you're accustomed to have a regular period at every time for the month, and you realize that I'm having in-between bleeding. I'm having maybe some watery, blood stain, foul smelling discharge. And so those are things you have to look for, because you don't, and if you have painful sex, or if you have urinary tract infections very regularly, those are things you pay attention to.
And what are some of the causes?
Beg your pardon?
And what are some of the causes of cervical cancer?
Some of the causes, well, some of them we can change, some we can't. So for instance, age, we can't change our age. So as we get older, we are more at risk for cervical cancer.
Oh, wow.
So in late 30s, going into 40s, 50s, 60s, we are at risk. If we have multiple pregnancies, we are at risk, because again, the cervix is being traumatized with each pregnancy, and as that happens, changes in the cells occur, and so it can expose us to cervical cancer. Hence the reason for the pap smear. We have our sex, we can't change, our race, we can't change our race. Black women are exposed, so we can't.
Oh, wow.
Women who smoke, we advise them not to, because smoking can cause changes in the cervical cells, because the byproducts of tobacco can cause changes. It can change something in your DNA, so we advise no smoking. We also have persons, multiple sexual partners. We advise, again, you can use condoms or try to cut down on that part. So that again is a problem. And then if you have a weakened immune system, HIV, if you had chemotherapy and your system is weakened, then you could be exposed to cervical cancer also. Those are just some of the causes of cervical cancer.
I was asking, outside of having a pap smear regularly, what else can women do at home in their own personal lives to prevent them from getting cervical cancer?
Well, as I said before, so we can stop the smoking, that's for one. Or if we are secondhand smoke is a problem, so keep from the smoke. We can, as I said, use condoms, decrease the sexual partners, that's two. We can try to boost our immune system, so vitamins, water, fruits, vegetables, keep away from those sugary and salty stuff also, because you want your system to remain healthy. And remember, the HPV virus, if you have that, it can ward off itself within 1 to 2 years if your system is healthy. So if you take care of your body, then the virus will not affect you. So you have to take care of that system.
All right,
also,
well, again,
we have to avoid stress. We have to avoid, let me say, intense stress, because we can't avoid all this stress, because there are a lot of stresses going around.
Yes.
And we can't avoid all of the stress. So, but we have to try the intense stress and stressing every day. It will change something in our bodies and then cause us to get the cervix to get disturbed, and we can get cervical cancer. And the one thing that a lot of persons do not like to hear now is the vaccine. We do have an HPV vaccine. Unfortunately, it is only given to the children in grade 6 at this time. However, the FDA has approved it for persons 9 to 26, and we give both males and females.
So I'm happy to hear that. I'm also happy that you're advocating that, we live a little less stressed out. So
Yes.
Can you remind us, in our final moments, the details of the event? Where is it, the time where the women can go to get tested? And is there a cost?
Okay, so it's free, of course.
Okay.
And even when we do it at each health center 1 day per week. It's free, so you don't have to pay. But this coming Saturday, January the 29th, we are going to have our drive. We call it a drive because that's when we see over 100 and something women. So we call it a drive. It's free. It's at each health center. It starts at 8 a.m. We finish at 12. However, if you are there, we will not turn you back. So whenever we finish, we are finished. So we're asking women to come out and have their pap smears. And I want women to know that the procedure itself, it's simple for the nurse, but uncomfortable for the client.
And it's
But we try
very
to
quick
allay
from my
their
own
fear. We try
experience.
to allay their fears. Yes, we try to allay their fears as much as possible, and we inform them as we go along with the procedure. When we are doing the procedure, we have them lie on the bed, and that in itself might be uncomfortable if they're not accustomed. Then we have them put in a position that their knees are bent, their legs are drawn up and then fall apart. So imagine you don't know me and then you this position in front of me. So we have to try and allay their fears as much as possible. Then we drape the client to at least to enhance their privacy. And then the nurse puts on her plastic apron or sterile gloves. And we put the speculum in. We ask them to take deep breaths. We use a plastic speculum or we use a metal speculum, depend on the client. And then when you put that speculum in, then the cervix will come through that duck beak, we call it. When you open it, there's this cervix. Then you take your cyto brush, a small brush like this, if you can see it. I don't know if you can see it.
You may have,
cyto
yes.
brush.
Okay.
And we use the cyto brush, and this brush goes right onto a zone in the cervix you call a transformation zone. That zone, as the word transform implies, that's where all of the changing of the cells takes place. So we put that cyto brush there, and then we do a 360-degree turn. And then it's gone onto a glass slide, a fixator spray is applied, the client's name is on the slide, and that goes with the form to the lab.
Okay. And again, it's not a long procedure. It doesn't last a long time.
It's not a long procedure. It's not a long procedure.
Right. Okay, I want to say thank you, Nurse Walters. That was very informative. And again, we want to invite all the women in Nevis to go to the healthcare centers on the 29th. That is Saturday coming from, is it 10 a.m. to 12?
Yeah, no, it's from 8 a.m.
8 a.m. to 12.
Midday.
To 12 midday. Yes, to get your free testing.
And it's on 12. And it's free.
All right. Thank you so much, Nurse Walters.